Have you ever noticed an unusual bump or change in your genital area and immediately felt a wave of panic? You're not alone. Today we'll explore what these changes might mean and when you should actually be concerned. Genital skin changes, when to worry and when to relax. Genital skin changes are incredibly common, yet often surrounded by silence, shame or fear. But here's the truth, most causes are harmless. Still, some signal conditions that need attention. Knowing what to look for is the first step in staying healthy and calm. Not every bump is a red flag. Some are caused by daily habits like shaving or wearing tight underwear. Others may be linked to skin conditions or infections, some mild, others more serious. The key is learning what's typical and when it's time to get checked. Let's look at common causes that usually aren't serious. First, folliculitis or shaving bumps appear as red, white or pus-filled bumps near hair follicles. They're typically caused by shaving, sweating or friction from tight clothes. Use a warm compress, avoid shaving the area for a bit and keep it clean. Sebaceous cysts are smooth, round and flesh-coloured or yellowish bumps under the skin, caused by blocked oil glands. They're often harmless. Don't squeeze them, but if one becomes painful or infected, a doctor can drain it safely. Skin tags or ingrown hairs appear as tiny flaps of skin or bumps that might look irritated. They're usually caused by friction, tight clothing or shaving. While typically harmless, check with a professional if something doesn't look or feel right. Now let's discuss conditions that may require medical attention. Genital warts are caused by certain strains of HPV and appear as small, soft, flesh-coloured bumps, sometimes in clusters. See a doctor for treatment options, as warts can spread if untreated. Genital herpes is caused by the herpes simplex virus and appears as painful blisters or sores, often with tingling beforehand. See a healthcare provider, as antiviral medication can help manage symptoms and reduce outbreaks. Molluscum contagiosum is a viral skin infection that appears as small, shiny, dome-shaped bumps with a dimple in the centre. It often goes away on its own but can be contagious. Consult your doctor if it spreads. Syphilis is a bacterial infection that appears as a single, painless sore, chancre, in the early stage. Urgent medical treatment with antibiotics is needed, as syphilis can cause serious complications if ignored. Lichen sclerosus or lichen planus are chronic inflammatory skin conditions that appear as itchy white patches or purplish flat bumps. They need medical evaluation, and prescription creams can help manage symptoms. When should you see a doctor? Don't wait if you notice bumps that don't go away within a week or two. Pain, burning or unusual discharge, sores that crust, bleed or keep coming back, or changes in the size, colour or shape of any lesion. It might feel awkward to bring up, but doctors are trained to help, not judge, and acting early could make all the difference. Your body will change, sometimes in surprising or uncomfortable ways, but genital bumps or skin changes aren't always signs of danger. Many are common and treatable. The real risk comes from staying silent or avoiding care. Be informed, be kind to yourself, and most importantly, don't ignore your health. Your peace of mind is worth a conversation. If something doesn't look or feel right, trust your instincts and talk to a healthcare provider. Let's recap what we've learned about genital skin changes. Remember, most changes are harmless and often related to everyday factors like shaving or tight clothing. Common harmless conditions include folliculitis or shaving bumps, sebaceous cysts, and ingrown hairs. These typically resolve with simple home care and good hygiene. However, some conditions like genital warts, herpes, and syphilis require medical attention. If you notice persistent symptoms, it's important to consult a healthcare provider. See a doctor if you have bumps that don't go away within 2 weeks, pain, unusual discharge, or sores that bleed or keep returning. Early treatment often leads to better outcomes. Above all, remember that your health matters. Don't let embarrassment prevent you from seeking care. Healthcare providers are trained to help, not judge, and addressing concerns early is always the best approach. Thank you for watching our guide on genital skin changes. Remember, your health matters, and there's no need to feel embarrassed about discussing these concerns with a healthcare professional. Stay informed, stay healthy, and take care of your body.